Hi, Mrs. Smith. Dr. Wyatt asked me to go over your discharge information sheet, and I'd like to go over your medication list with you. Your list will tell you the name, the dose, the amount of medication you should take, and how often you should take it each time of the day.
Okay, thank you.
Good. I wanted to be here for my mom. I'm usually the one that sets up her pill boxes and her pills for her every day. So you said my mom's going to have some medication changes?
Yes. Previously, you were on carvedilol, 12.5 milligrams twice a day, and he has increased that to 25 milligrams twice a day. So you mentioned that you have a pill box. So it's very great that you're working with your mom to have the pill box that we can help set that up. Can you tell me, are there any problems that you ever have with taking medications twice a day?
Sometimes I forget to take my evening dose.
Okay. Are there any things that you have thought of that may help you to remember the evening dose?
No, usually I just forget because I watch my shows and then before I know it, it's time for bed. So I just kind of forget.
Okay. Some people do use their medication boxes. Some people use an alarm. And I think that you mentioned that your daughter recently got you a...
She got me an iPhone.
Wonderful. So there's an alarm on the iPhone, and that some people like to set that so they remember when to take their medications.
Oh, I could do that.
Okay.
That's great.
All right.
So with the medication I'll let you read the bottle and tell me what it says on the bottle.
Carvedilol, 12.5 milligrams 2 times a day.
Okay, and Dr. Wyatt has increased that to 25 milligrams twice a day. So tell me how you would set that up in your medication box and how many pills would you take at a time?
Well, I would take 2. So I would take 2 tablets twice a day, and I'd set my alarm so that I wouldn't forget.
And
Okay.
Mom, I'll also call you to remind you for the first few
She's so
weeks.
good. She's always calling me.
Very good. I think that's very important. Now, how do you know that you have enough medications? Do you get your medications mailed to you? Do you get them at a local pharmacy?
Usually my daughter will pick them up from the pharmacy for me.
Okay. And are there any challenges with being able to get your medications?
No, I do the $4 plan.
Okay,
so,
great.
You know, like financially, we're okay with that.
Great.
Sometimes I would forget to refill, and I would go like just a day or 2 without it. But then, you know, I would take them after that.
It's very important to take your medications as prescribed. When you look at the bottle, you can see how many tablets are in the prescription bottle and then when your refill can be done. Some pharmacies have it that you can set up an automatic refill so that they'll send you a reminder when it's time to refill your medications.
Okay.
So that you don't run out. What would you do if you did run out of medications?
I call the nurse over at Dr. Wyatt's office.
Okay. And get the refills that way.
Yeah.
It's important to know when your prescription is getting close to running out. When you have a pill box and set it up by the week, then sometimes you can see how much you have left. And it's always good to have at least 2 weeks on hand. So those
Oh.
are some different tips that may be helpful to keep you.
All right. So I don't miss any. Like, I mean, is anything bad going to happen if I miss a couple doses, or?
Well, it is a challenge to, the medications are very important to your health, and it is important to be on the right doses. So sometimes if you miss several doses, we may need to readjust the medications.
Oh, okay.
We
All
have to
right.
work
I
on
won't.
that.
I won't.
Okay.
We'll work on that. I won't forget anymore.
Okay, so if we can just finish going over, that was the explanation on the carvedilol.
Okay.
Now we can keep going over the rest of the list and go over the rest of your medications.
Okay.
Okay, great. Great. Thank you so
Thank
much
you.
for spending the time with us to go over this.
Thank you for being here. It's great to have a family member engaged.